What happens at a medical conference? Why is it important for physicians to attend these medical conferences? And if you are somebody who is thinking about attending a medical conference, then how can you make the most out of it? So these are some questions we're going to be answering in today's video. Hi everyone, Dr. Nabila Noor here, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. If you're new to the channel, welcome. Here we talk about everything pelvic health. So if you like what you see, don't forget to subscribe and share it with a friend. So today's video will be slightly different than my traditional videos where I usually talk about a medical topic. Instead, today I'm going to discuss with you my reflection of our most recent national meeting. So I just came back from my national meeting, which is the American Urogynecologic Society meeting, also known as Augs. So this year the meeting was held in Washington, D.C., and it usually happens over a span of 4 days. It's an amazing conference where you have urogynecologists all across the United States coming together, and not only urogynecologists, but we also have other healthcare providers who are involved in our field. So we have physician assistants, nurse practitioners, a lot of industry who are involved in our field, as well as medical students, residents, fellows, anybody working in the field of urogynecology coming together to discuss what is the hottest and latest thing that's happening in this world. So in this year's meeting, we had a lot of amazing research being presented at this conference from all across the United States. We talked about some of the advancement with regards to treatment for pelvic organ prolapse, urinary incontinence, as well as pelvic pain. There was also a lot of focus on some of the new innovations with regards to surgery, especially in robotic-assisted surgery. Now, the event also emphasized a more interdisciplinary approach in taking care of our patients, especially in regards to collaboration with pelvic floor physical therapists as well as pain specialists, which led to an interesting discussion about how we should really approach patient care in urogynecology from a holistic perspective. There were also a lot of networking opportunities, which was very exciting. Not only did I have a chance to connect with my mentors and my friends, I also had a chance to collaborate with others who have similar interests as mine in taking care of our patients. There are usually multiple sessions that happens at the same time, so it's not possible for physicians to attend all the different events. So sometimes we have to pick and choose of which particular session we want to go to. I attended many interesting sessions, but some of the highlights were I attended a session that talked about the crossover of urogynecology, sexual medicine, and hormonal treatment for patients. Now, as urogynecologists, we're amazing surgeons, but we often don't get a lot of training in sexual medicine. Now, many of my patients in urogynecology are women who are going through menopause and as a result are developing some of the pelvic floor issues that I treat, such as pelvic organ prolapse, urinary incontinence, fecal incontinence, but it's also a time when a lot of these women, because of the hormonal changes, are noticing changes to their intimacy, to their sexual life, to their libido, their arousal, and a lot of these things we don't necessarily discuss with our patients. So there's been a lot of emphasis on improving the surgical treatments that we offer for our patients, but I think over time what we're realizing is that patients appreciate a more holistic approach. Many patients want to be conservative, and most importantly, they like options. They like options of choosing a conservative approach if possible, focusing on more exercises such as pelvic floor exercises, behavioral changes, lifestyle changes, hormonal therapies, and of course surgery when appropriate. I also attended another session that was titled Early Careers Day, which was very interesting, which highlighted the various different practice models for physicians all across the United States. Traditionally, most physicians worked at a hospital, which is usually affiliated with an academic center where you have a lot of opportunities to do research, you work in collaboration with other physicians. But at this session, we got to hear from physicians who are practicing solo, so private practice physicians, and they were able to use technology, also modify their practices based on their individual patients' needs. It also talked about some physicians who were really innovating some amazing tools for us to be able to teach our future physician surgeons. For example, one physician was talking about how she had created a device that will hopefully enhance how we're training our current physicians in training. So those are our residents and fellows, just by, using virtual reality to be able to learn how to do surgeries before they actually operate on patients. It's amazing advancement in technologies. We learned about physicians who are going into more administration to be able to make decisions that help drive our healthcare for the future. We learned about some physicians who are working for the government, so the FDA, so that they can be a part of the policy changes that happens in women's healthcare. I also attended a session that talked about latest research that has been really a game changer in how we practice urogynecology and how we best take care of our patients. So to be able to review those articles, talk about it, and learn about how we can bring those new guidelines, new changes into my own practice so I can take the best care of my patients. Now, I do want to say that I've attended many medical conferences in my life, but this conference was special because I came back feeling really inspired, really grateful for everything, really feeling hopeful and excited about taking care of my patients. Now, conferences can be overwhelming, but if you're strategic about it, it can be a great source of inspiration. So I want to end today's session by giving you a few tips about how to make the most out of these medical conferences, because these are some things that I did for this particular conference, and I really came back feeling amazing, feeling like I have a clear goal of how I can use some of the things that I learned in these conferences to be able to take best care for my patients and also to enhance my career professionally and feeling inspired and empowered. So the first tip is plan your schedule. And it sounds silly, but it is so important. These conferences are busy full days. For example, our conferences, the day started at 6:45. We know there are many sessions throughout the day, and for some sessions, there are multiple sessions happening at the same time. If you know the schedule ahead, you can really focus on what are some of the sessions that you want to attend that is relevant to you and your practice and your patient population, so you can make the best use of our time. If you're just finding out about the schedule the day off, you may sometimes miss some interesting sessions. Like I said, this time I was very strategic. I knew way ahead what the schedule was. I planned, because a lot of the times there are workshops that is separate from the regular conference, and these workshops, unless you sign up for it, you're not going to be able to attend. So I attended 2 additional workshops. One was about the sexual medicine and the other one was about the early career stage. It was 2 of the most inspiring sessions for me. If I didn't plan ahead, I would not even be familiar with this. Number 2, setting clear objectives. So similar to, knowing the schedule and planning ahead, setting clear objectives can really help physicians to be able to get most out of the conference. And I wanted to make sure that I had a chance to network with some of the physicians and some of my mentors. I had an objective of connecting with some of my peers and some of the physicians that I've worked with, and also meet some new physicians. I also made an objective that I wanted to participate actively. So I actually hosted a roundtable discussion. So the topic of my discussion was tips and tricks for the new urogynecology attending, things I wish I learned in fellowship. So this is a topic that I feel very passionate about. We learned so much medicine in our medical training, but some things, like some of the practical tips of how to create your clinic schedule, how to be efficient, how to have a busy surgical practice, how to be efficient in the OR so you can finish at a decent time and not burn out. Little tips and tricks that I learned over the first few years of my in practice, I wanted to be able to share with some of the current physicians in training, and it was so well received. Everybody loved it. It was a full house, and I got so many requests of continuing to do this on a yearly basis. But again, going back to my original point about setting objective, I set an objective for myself that not only am I going to be a passive learner, I wanted to engage actively, and it was really important for me to be presenting in some fashion so that I can do that. Number 3, engage actively in any sessions you attend. And what this means is that it's very easy to be just listening to a lecture and zone out. We've all done it, whether it's in school or even as physicians. So being actively involved, taking notes, asking questions at the end of the session, going up to the stage and talking to the presenters can be a really nice way to show your interest and also get the most out of it. Because if you're just listening passively, or worse, you're kind of on your phone where you're trying to listen, you may lose some key points. Number 4, Networking with a purpose. We all know and we've all heard it and are told all the time that conferences are a great place to network, as you get to meet people, you get to meet new opportunities, especially if you're somebody who's looking for a career change or job opportunities. It can be an amazing place to meet people who can help you with that. But again, at different stages of a physician's career, networking can look different. Now, networking doesn't only mean networking with other physicians. It could be with other healthcare providers. For example, physician assistants, pelvic floor physical therapists, research collaborators, industry partners. Again, networking with a purpose. If you're somebody who's looking for opportunities to be able to teach, whether it be for industry or at an academic institution as a speaker, or collaborate with a particular brand that you feel very strongly about and you want to be marketing for them, these are all opportunities that can arise from you being at a conference, but you have to be smart about it and look out for them. Number 5, visiting the exhibit hall. Every conference will have an exhibit hall, and what that means is lots of companies, lots of our industry partners come to those exhibit hall and basically showcase their products, their services. Us as surgeons, for example, because we are a surgical practice, there are lots of companies that bring in with new surgical instruments or talk about new surgical technologies, a lot of new medications and therapies. These are all displayed at the exhibit hall. So finding the time to go through those exhibit hall can be a source of inspiration, and also you may find something new that you can bring back to your patients and potentially help them. Number 6, reflecting on what you learned. So discussing what you learned with other colleagues, other partners, maybe physicians or colleagues who couldn't attend the conferences. So through reflection, you can come up with new strategies, new ways to take care of patients, improving your patient flow and overall improving patient care. And finally, following up with your connections. If there are people you connected with, people you spoke to, or people that you networked with, follow up. Send them an email. Talk about how you're going to implement some of the things you learned from your conversations with them into your practice, and build that relationship, because that's how you grow your network. And as the saying goes, your net worth is your network. Have meaningful communications and interactions that can continue long after the conference. So in summary, taking an intentional goal of how to maximize your time at this conference not only provide amazing opportunities for you for professional growth, for building your network, but to also allow you to provide the best possible care for your patients. Hope you found this video helpful. It is a little bit different than my traditional videos, but I think it's important for me as a physician to share this experience with you, because patients like to know what happens at these conferences. I hope I was able to give you a glimpse of what happens at these conferences, and you get to hear a little glimpse of what happens at these conferences and why it's important for us physicians to attend these conferences so that we can provide the best possible care for you. If you haven't already, don't forget to subscribe. And if you want more helpful tips about your pelvic health, you can also sign up for my newsletter, which should be linked below. Talk to you soon. Bye.